Speaks.
Hello. And welcome to the Paul Presley Show. I would first like to say, Paul Presley is not a doctor and does not pretend to be one. This and other shows are to make you aware of health matters you may not know about. It is only used as an informative tool. The opinions expressed on the Paul Presley Show are published for educational and informational purposes only, and are not intended as a diagnosis, treatment, or as a substitute for professional medical advice, diagnosis and treatment. Please consult a local physician or other healthcare professional for your specific healthcare or medical needs or concerns. A note from Paul Presley. Remember, I am not a doctor. I only tell you about health problems I think you and your family and friends should know about. Please consult a local physician or other healthcare professional for your specific healthcare or medical needs or concerns. Thank you.
How are we doing out there? Is everybody surviving? I hope so, and I hope everything is good. Okay, right now I have a medical show, and that means I have to tell you this. Along with my disclaimer in the front, I have to tell you one more time with my voice that I am not a doctor. D-O-C-T-O-R, I am not. So take that to heart when you listen to this show. Okay, I only talk about conditions that I have, that I see doctors for, and doctors give me the information and I retain it, and I hope that maybe I can help somebody out there in radio land. Now, the reason why I'm here is to bring you this show, and it's called Brugada Syndrome, the Silent Killer. Now, what we're going to do, I gave you the title, so I want to have my little friends tell you about the two brothers that discovered this. Okay? I'll be right back.
Hello, Paul. And good day to all listeners out there. Brugada Syndrome, the silent night killer. Who are the Brugada brothers? Cardiac arrest and syncope, which occurs mostly in the time of rest or sleep. In 1992, two brothers, namely Joseph and Pedro Brugada, discovered this disease. It was causing sudden death by ventricular fibrillation. This disease was more prevalent in people of Asian origin than the American and European population, of which type 2 and 3 ECG patterns are most common. The average age of patients that die from this disease are around 35 to 40 years. This disease is a conduction disorder, characterized by incomplete right bundle branch block, and a coved type ST elevation of more than 2 mm in leads V1 to V3. In the Philippines, it is known as to rise and moan sleep. Okay, Paul, and good morning to you, big guy. Take it away.
Okay, that was a great job. Thanks a lot, guys. And you know, the problem is with me is I hear those stories, and the story I'm about to tell you, that I didn't realize that I was eventually going to have the Brugada syndrome and have to end up with a defibrillator and a pacemaker right here in my little chest, my little buddies. And let me tell you, it takes a little bit to get used to it too. What happened? 2015, I got into an auto accident, and I was very severely injured. I had pelvic area and the tibia, left tibia, and a bunch of things happened, ribs cracked, all that stuff. I actually had to learn how to walk, okay, again, and that was a pain in the tuchus. Anyway, then through that, I realized that I was going to have physical therapy. So this is the story. I went to physical therapy several times. One day I went in and I was on the bike and I was pumping and everything, trying to get my legs and my hips and everything back to normal. And as I was doing it, I had to go to the bathroom. So I went to the bathroom. I got in the bathroom and I was in there hanging out, and I started feeling a little bit feverish and a little bit sweaty and everything, and my legs were rubbery and I couldn't walk, and I stumbled over to the chair and I passed out right in the waiting room. And so, my girlfriend was there, and the cops came and everything, and I ended up in the hospital. Okay, so that's the incident. So once again, I was in that situation like I was many years ago, where they used to give me an EKG, and they would find a black spot on there and say, "Have you ever had a heart attack or a stroke?" And I said, "No, why?" And they said, "We see a little spot. It may not be nothing, but what the hell?" I said, "Okay." So then, after I passed out that one time and ended up in the hospital, was there, I don't know, a couple of weeks, I guess. And then I got out, and then I was at home one day, and I actually felt it coming on, because I don't know, I was just nervous. I went to bed that night, and I felt something coming on. All of a sudden, my girlfriend goes, "I can't understand you. It sounds like you're speaking a foreign language." And then I fell down. My legs were rubbery, and all I could say to her was, "Call the ambulance." Then I ended up in the hospital. Okay, and that's how I later found out that I had the Brugada syndrome. Was a very good thing that I got my little buddies in my chest here. They look pretty good, and they feel pretty good. I want you to listen to what my friends have to tell you. They're going to tell you a couple of things about the Brugada syndrome. And be right back.
Okay, Paul, here we go. My name is Hazel. I am now going to tell you a little about Brugada. Overview. Brugada syndrome is a potentially life-threatening heart rhythm disorder that is sometimes inherited. People with Brugada syndrome have an increased risk of abnormal heart rhythms from the lower chambers of the heart, ventricular arrhythmias. Many people who have Brugada syndrome don't have any symptoms, and so they are unaware of their condition. A telltale abnormality, called a type 1 Brugada ECG pattern, is detected by an electrocardiogram (ECG) test. Brugada syndrome is much more common in men than women. Our host, Paul Presley, just had these procedures done, and says he feels great. Pay attention to this next part, it is important for controlling the symptoms. Brugada syndrome is treatable with preventive measures such as avoiding aggravating medications, reducing fever and, when necessary, using a medical device called an implantable cardioverter defibrillator, ICD. Is that true, Paul? Do you feel as good as you sound?
Okay, thank you guys for those clips. You did a good job as usual. Okay, now, coming up, we have some more information for you about the Brugada disease. What I don't like about it is, when I got into that accident, I was taking medication at home to sleep. And I found out by reading and studying the disease, it is one that attacks at nighttime when you're sleeping. So that bothered me. So first thing I did was I stopped taking all medications that were putting me to sleep, so I wouldn't die in my sleep, because I couldn't feel the fact that I was having a heart attack or a symptom of, right? Okay, so I took Tylenol, I pulled through the night, had a little snooze, and I was fine. Okay, so now what we're going to do, the girls are going to give you another couple of clips. The first clip is symptoms of the Brugada disease. So listen to what that says. And then the second one is the risk of having the Brugada disease. Okay? So when you get those two clips done, I'll come back and we'll talk some more. Okay, so be sure you listen, and listen good, okay? And you'll learn something, and you can call your doctor and you can find out and let him know what's going wrong with you. Get an EKG, and you can figure this out for yourself with a doctor. We'll be right back.
Okay, here we go again, Paul. You need to have all the facts. Here are the symptoms. Many people who have Brugada syndrome are undiagnosed because the condition often doesn't cause any noticeable symptoms. The most important sign of Brugada syndrome is an abnormal pattern on an electrocardiogram, ECG, called a type 1 Brugada ECG pattern. You can't feel a Brugada sign, it's only detected on an ECG. It's possible to have a Brugada sign, or pattern, without having Brugada syndrome. However, signs and symptoms that could mean you have Brugada syndrome include: Number 1. Dizziness. Number 2. Fainting, syncope. Number 3. Gasping, labored breathing, particularly at night. Number 4. Irregular heartbeats or palpitations. Number 5. Extremely fast and chaotic heartbeat, sudden cardiac arrest. Brugada syndrome signs and symptoms are similar to some other heart rhythm problems, so it's essential that you see your doctor to find out if Brugada syndrome or another heart rhythm problem is causing your symptoms. Okay, Paul. Back to you. Who is most likely to have the Brugada syndrome? Brugada is rarely diagnosed in young children. Risk factors. Risk factors for Brugada syndrome include: family history of Brugada syndrome. If other family members have had Brugada syndrome, you're at an increased risk of having the condition. Being male. Adult men are more frequently diagnosed than are women. In young children and adolescents, however, boys and girls are diagnosed at about the same rate. Number 1. Race. Brugada syndrome occurs more frequently in Asians than in other races. Number 2. Fever. While having a fever doesn't cause Brugada syndrome by itself, a fever can irritate the heart and stimulate a Brugada-triggered faint or sudden cardiac arrest, especially in children. Paul. Is this what happened to you? Don't be bashful, you can tell us.
Yes, exactly. That's exactly what happened to me. So I have my little friends, and I'm going to put up a picture so you can see this on screen, and it shows exactly where the defibrillator and pacemaker fit in your chest. And it was not very long or painful. I hardly felt anything getting the operation, and it was smooth. I was in there like maybe 45 minutes to an hour in recovery. Once I got out, the surgery took about an hour, maybe a little bit longer, and I was very happy and pleased with the outcome. So, like I say, if you think you have any of these symptoms that you've been hearing, and there's a couple more to come up, and then we're out of here. And if you have any symptoms that you hear on here, contact your heart doctor or family doctor or whoever can get you in touch with somebody that can help you. Okay, you need to talk to somebody, tell him your symptoms. Here's a little trick somebody told me to do next time. If you feel like you're having any kind of a heart attack or a symptom or anything like that, just make sure you have a pen and paper handy and write down the symptoms, how you felt, what your temperature was. Take your temperature often too. That's one thing if you're having any kind of pains and stuff. And watch your temperature so you don't crash like I did. But luckily I pulled out of it and everything's fine. So now next one you're gonna listen to is complications, and we're gonna go from there to if you need to see a doctor. When should you see a doctor? Pay attention to all these, and we'll be right back.
Okay, Paul. Here we go. These are a few things to look for. Here are the complications. Complications of Brugada syndrome require emergency medical care. They include: Number 1. Sudden cardiac arrest. If not treated immediately, this sudden loss of heart function, breathing and consciousness, which often occurs while sleeping, is fatal. With fast, appropriate medical care, survival is possible. Administering cardiopulmonary resuscitation, CPR, rapid compressions to the chest and an external shock from an automatic external defibrillator, AED, can improve the chances of survival until emergency personnel arrive. Number 2. Fainting, syncope. If you have Brugada syndrome and you faint, seek emergency medical attention. Hey Paul, I want to ask you a question. Did you ever have any of these symptoms? Okay, Paul. Here's the million-dollar question. When to see a doctor? If you have heart palpitations or an irregular heartbeat, arrhythmia, make an appointment to see your doctor. Your problem could be caused by a heart rhythm problem, but tests can determine if the underlying cause of your heart problem is Brugada syndrome. If you faint and you suspect it may be because of a heart condition, seek emergency medical attention.
Okay, that's it. Yes. And thanks for all of my little buddies up here helping me out reading those scripts for me, because you know what? I have a hard time reading nowadays. Yep, that's it. So we're going to say bye-bye, and Enid will be back on the next show. This is a show that I wanted to do by myself, and because it's something kind of dear to me, dear to my heart. Okay, so we'll see you later next time on Press Speaks. Okay, adios, guys. Okay, we got another one under our belt. How you feel?
Really good.
I feel good about that too. And you know what I like to feel good about when I do something?
What?
I like to sing. What about you?
I love it.
So what are we going to end with?
A song by Roy Rogers and Dale Evans, Happy Trails.
And here you go. Happy trails. And we'll be back next week with another show, so stay tuned. Happy trails to you until we meet again. Happy trails to you. Keep smiling until then.
Who cares about the clouds if we're together? Just